It's time for a tip from the team. Today's question is, what does a mammo screening at SRMC look like? Offering a tip to address is Radiology Director Adam Stevens. Adam, can you give us an inside look into a mammo room?
Absolutely. So this is our new General Electric Pristina mammography unit. This is, of course, where the patient will stand. This is what we call the bucky, and this is a compression paddle. So the patient would stand in front of this unit, and the tissue would be placed here. The compression paddle will come down to compress that tissue. Now, something that's new and unique about the GE Pristina unit is that the patient has a control, and they can control some of the amount of compression being applied. And that is something that we have never had before. Another nice thing about this unit are the rounded, soft edges, and there are handholds for the patient to grab onto so that they can be more comfortable during the mammography procedure. Another part of the fear or the anxiety that people have about mammograms deals with the compression. So that's the part of the mammogram that can be a little bit uncomfortable. This machine is different. So the technologist will still apply compression much as they would have in the past, but now the patients are given a controller so they can control some of the compression. The patients are actually able to apply a little more compression if they feel that they can tolerate that to get a better image, but if the compression becomes too much for them, they can also press a button to release some of that compression. Another thing that we're excited about with this machine is an improvement in the image quality. So with this machine, it gives us 3D capabilities. A 3D image is much clearer for the radiologist to look at, and it allows the radiologist to actually look inside the tissue better to differentiate between what might be normal tissue versus abnormal tissue. With the radiologist being able to do that, you will have less callbacks. So that means the patient can come in for their yearly mammogram and they can leave and not have to come back for further imaging because these images are so much clearer. And another part of the experience with this new mammography unit is working with the patient's senses to help decrease anxiety and make them a little bit more comfortable during this procedure. When I'm talking about the patient's senses, I'm talking about sight, for instance. You can see the monitor here on the wall. This monitor, the patients are able to select a different scene to be reflected on these monitors. So for instance, they can have a waterfall, they could have a forest, or an ocean, and they can watch the ocean waves coming in. So that's one of their senses. Another sense that we try to elicit a response from would be sound. So there will be sounds. They can hear the waves of the ocean, or they can hear birds on the forest scene. And also this room has a component for the sense of smell. We can actually use different smells to make the room more approachable and feel a little more friendly to our patients. Part of the experience with this new mammography unit is really geared towards patient comfort. We want the patients to be as relaxed as possible. Patients who are relaxed, we get better images for the radiologist to look at. So this machine has been designed with patient comfort in mind. It's just got a much more patient-friendly look to it. GE has designed handholds with lights, guide the patient where they can grab. Another thing about this machine is it doesn't matter the patient's size or height. This machine can move in any direction it needs to move to accommodate a wide variety of patients. So a patient who might be in a wheelchair, we can lower the machine down and easily accommodate them. Same thing for a taller patient. We can raise the machine up and we can accommodate those patients. Normally, you would have to go as far away as Denver or Fort Collins to find a machine that has this capability. But now that we have this locally, now that it's available here in Sidney, Nebraska, I just want to encourage everybody, come in, get your yearly screening now.